you. So again, greetings everyone. Welcome to the first day of the virtual Green Hospitals Asian Pre-Conference. So if you have attended any previous Green Hospitals Asian conference, we'd like to hear, your experience, and if you can share your experience attending the same conference in the previous years, please do type it in our chat box so that we can share our experience attending the previous GHAC. As you know, I think this is the first virtual GHAC pre Green Hospitals Asian Conference that we're doing. So today's opening plenary theme is Path to Healthy Recovery. The COVID pandemic has disrupted the whole operations of the health system. And while it is ongoing, climate change is also intensifying. This opening plenary, we will tackle the current challenges between health, the pandemic, and climate change, and how the health sector will be able to create a path of recovery that is climate resilient, equitable, and sustainable. After the plenary session, the organizers prepared a networking activity to help you expand your network of health professionals, experts, advocates, and stakeholders in the field of sustainability and climate change. You may use this opportunity to meet people with the same goal, exchange business cards, and learn or share your experiences with them. To formally open this year's Green Hospitals Asian Pre-Conference, I would like to call on the former Philippine Department of Health Secretary and the current Chairperson of Healthcare Without Harm Southeast Asia. Please go on stage now, Dr. S.P. Cabral.
Thank you so much, and good afternoon, everyone. It is my privilege and great pleasure on behalf of Healthcare Without Harm Southeast Asia to welcome the participants of this year's virtual Green Hospitals Asian Pre-Conference. Warm greetings to all the healthcare professionals, medical workers, and students, hospital administrators, government leaders, and advocates in the environment and climate fields who are here today, as well as to all our guest speakers, especially Dr. Mark Jacobs from the World Health Organization, who is our keynote speaker this afternoon. The past 2 years have been challenging years for all, including, or maybe, especially for the health sector. The Green Hospitals Asian Conference, a biannual event bringing together hospitals, health systems, and climate advocates of green, sustainable, and climate-resilient healthcare, was supposed to happen this year, but was postponed due to the volatile COVID-19 pandemic conditions. We are not phased. We gather virtually in a Green Hospitals Asian Pre-Conference to acknowledge that climate change will not stop and global health will be increasingly at risk if we do nothing. We are here to recognize the long journey we have to take to bring us closer to our goal of a healthy planet with healthy people. We are also here to celebrate our milestones and achievements and to honor our green healthcare heroes and discuss how we can build on their successes. The theme of the conference, Building Strong Healthcare Climate Commitments and Actions, is critical now more than ever. The United Nations Climate Change Conference in Glasgow just concluded. It was heartening to see the active participation of the health community in the climate negotiations. However, we are disappointed that the commitments to climate action fell short of what is necessary and the call to support vulnerable countries went unheeded. Hence, the need for us to continue to define a climate-resilient, equitable, and sustainable path of recovery from COVID and the climate crisis and address the challenges and barriers that prevent society and health systems from making strong decarbonization commitments. 4 sessions were organized so that we can engage and dive deeply into these issues. I invite you to participate in all sessions so we can co-create plans to take proper collective action. We are there not just to make strong commitments, but also to attain actual outcomes. I call the health professionals to rise to the climate challenge and reclaim our and the planet's health. I call the hospitals, health systems, organizations, and facilities to join the global movement to achieve green and sustainable health care. I call the government health leaders to take ambitious actions towards resilient and low-carbon health systems. I look forward to a strong climate commitment and actions that will be built in this 4-day event. Thank you, and have an engaging and fruitful virtual Green Hospitals Asian Pre-Conference.
Thank you, Dr. Cabral. And as you can see, there are a lot of clapping and smiling. Yeah, this is interesting. There's no sound.
Doc Glenn,
Yeah,
I'm jumping in here just to greet Dr.
Yes,
Singh.
I was going to say that.
Yeah, thank you, Doc Glenn.
Yeah. It's a special day also as we have our introductory speaker, Dr. Cabral. It's also her birthday today. So again, let's greet her a happy birthday with all of those emojis for happy birthday. Doctor, thank you very much for continuing to be a champion for us in the health sector. Right. Very inspiring indeed. Thank you. I'll now introduce our keynote speaker, Dr. Mark Jacobs. He is the director of the Pacific Technical Support for a WHO representative to the South Pacific. Dr. Jacobs was previously the WHO representative to Lao People's Democratic Republic, and before that was the director of communicable diseases in the region for 5 years. Now, before joining WHO, he was New Zealand's Director of Public Health for 9 years and managed the public health program at the Secretariat of the Pacific Community for 3 years. Let us now give our hands to Dr. Jacobs. Dr. Jacobs, you may now go on stage.
Great, thank you very much. I hope you can hear me. I'm very happy to be part of this this exciting conference. I'm consistent with my current job. I'm connecting from Fiji, and I'll get the Secretariat to put up the first slide in my presentation, please. Like many of us, I haven't used this particular app before, so I'm interested to see how the slides are quite small. So some of them you will have to take my word for what is on them, but I hope you trust how I describe them. So that just to assure you that the view that I have behind my computer isn't quite like the photo in my first slide there, but nearly. So you just have to imagine where I am as I'm talking to you. But of course, I'm paying much more attention to the conference than to the view. So next slide, please. Oh, I should say, so I'm going to be talking about the path to healthy and resilient recovery in the context of the COVID-19 pandemic. So next slide, please. So just starting with a little bit of information that we all know already. As has already been mentioned, we've just had COP26, and of course in the lead up to that, we had the 6th assessment report of the Ipcc. Many crucial bits of information that were highlighted in that report, not least of which flagging the unprecedented and potentially irreversible damage and impacts caused by climate change. And of course, there's many many impacts of that are already being seen. For instance, from the last 5 years have been the hottest on record since 1850. There's been a recent rate of sea level rise. It's virtually certain that the hot extremes we've been seeing, like heat waves, have become more frequent and more intense since the 1950s. And of course, as we're reminded by the top photo on that slide, that is already having a big impact on people. Next slide, please. Again, I won't go through this because we know these sort of pictures already, but the key point to make here is that nowhere in the world really is immune from the impacts of climate change, of global heating. Of course, the models suggest that there are variations between different parts of the world, and so far some of the temperature changes have been highest in the northern latitudes and over the big land masses. But no one can take comfort that they're going to be protected from this. It's an issue for all of us. Next slide, please. Again, don't worry about the text in this, but I'll describe it in general terms. On to climate change and health. As I'm sure everybody who's connected to this conference is already aware, climate change directly and indirectly impacts the health of populations and also the systems that are in place to protect and promote health through lots of different pathways. And it's strongly mediated by a whole lot of different factors like environmental, social, and public health determinants. A key thing to say, and again, I'm sure we all understand this already, is that climate change is already disproportionately affecting the most disadvantaged around the world, not least with their health, and delays in acting on climate change will further disproportionately affect those most disadvantaged. Now, the famous medical journal, The Lancet, earlier this year released their latest report on this, and it outlines a whole lot of different, very stark consequences of climate change for health. And just a few examples of that. In the past 20 years, heat-related mortality amongst people older than 65 has increased by more than 50%. Higher temperatures have brought increased dehydration, have brought renal function loss, skin cancers, tropical infections, adverse mental health outcomes, pregnancy complications, allergies, heart and lung illness and death. As I've already touched on, the harms disproportionately affect some people. They disproportionately affect the most vulnerable, including children, older people, ethnic minorities, poorer communities, and those with existing underlying health problems. So there's some of the direct things. Indirectly, for example, global heating is also contributing already to the decline in global crop yields for major crops, falling between 1.8% and 5.6% since 1981. So that, together with the impact of extreme weather, drying out of soils and so on, is hampering efforts to reduce undernutrition, for instance. And of course, as history really teaches us, widespread destruction of nature, including habitats and species, it's eroding water and food security, but it's also increasing the chance of pandemics. Nearly every new disease that has emerged and caused pandemics in human history that we know of has actually come from animals. And so harming the environment and changing the way that we interact with the environment directly impacts the risk of new diseases emerging into the future. So the overwhelming message is that climate change is already affecting people's health, and to the extent that emergency action on climate change can't be put on hold while the world deals with COVID-19 pandemic. Next slide, please. On the subject of COVID-19, of course, as we all know, and thinking about and seeing on the news every day, it's a global health crisis. It's claimed millions of lives. It's affected livelihoods and communities right around the globe. But we can't think of it as being completely separate to climate change and its health impacts. Both issues have exposed very deep fissures and inequities in the world's capacity to cope with and respond to health emergencies. And as I've just mentioned when I was talking about the previous slide, new diseases in history have emerged being linked to exposure to animals and the broader environment. So as WHO's Director General, Dr. Tedros, said recently, the pandemic is a reminder of the delicate relationship between people and the planet. Any efforts to make our world safer are doomed to fail unless they address the critical interface between people and pathogens and the existential threat of climate change that's making our Earth less habitable. Yet, having said all those negative things, it's important to realise that in its response to both these crises, the world's also faced with an unprecedented opportunity to ensure a healthy future for all. Next slide, please. As was made clear in a special report that WHO provided on climate change and health that was produced for COP26, governments can commit to a healthy and green recovery from COVID-19 by following an evidence-based path to a zero-carbon, resilient and inclusive global economy. The 10 recommendations in the report that are in those boxes on that slide that you probably can't read very clearly, and the respective action points under those different recommendations highlight the urgent need and the many opportunities for governments to prioritise health and equity in the international climate movement and the Sustainable Development Agenda. So for each recommendation, it's accompanied by a selection of resources and of case studies to help inspire and guide policymakers and practitioners in implementing the proposed solutions. And in my final slide later on, I'll show a link to this document. But to save you trying to read the small text in those small blue boxes, those 10 key recommendations, which I'll just touch on briefly. Firstly, commit to a healthy recovery. So in other words, a healthy, green and just recovery from COVID-19. Secondly, our health is not negotiable. So that's about placing health and social justice at the heart of the UN climate talks. Thirdly, harness the health benefits of climate action. So prioritising those climate interventions with the largest health, social and economic gains. Next, build health resilience to climate risks. I'll talk about that a bit later on. Next, create energy systems that protect and improve climate and health. So guiding a just and inclusive transition to renewable energy to save lives from things like air pollution, particularly from coal combustion, and also ending energy poverty in households and healthcare facilities. Next, reimagining urban environments, transport and mobility. So it's about promoting sustainable, healthy urban design and transport systems with improved land use, access to green and blue public spaces, and priority for walking, cycling and public transport. Then protecting and restoring nature as the foundation of our health, promoting healthy, sustainable and resilient food systems, financing a healthier, fairer and greener future to save lives, and listening to the health community and prescribing urgent climate action. So for the remainder of my brief presentation, I'm going to highlight just a few of the steps for two of those priorities, committing to a healthy recovery and building health resilience to climate risks. Next slide, please. In May of this year, WHO released another document called the Manifesto for a Healthy Recovery from COVID-19. So that publication provides an overview of the various recommendations and prescriptions by WHO for this area, and it's accompanied with a whole lot of actionables for a green and healthy recovery from COVID-19. So the practical steps that are in that report aim at creating a healthier, fairer and greener world while investing to maintain and resuscitate the economy hit by the effects of COVID-19. So COVID-19 has brought into very sharp focus the very fragile relationship between society, the economy and health. It's also demonstrated the need for resilient health and social care systems, as well as a renewed focus and public support for global health priorities. So the prescriptions in the report, I won't go through them because they echo the key recommendations of the document I just showed before, but you can see them there highlighted. Next slide, please. This one, and again, I'm sure we all understand this, but often when we in the health sector are talking about the importance of climate change, we're actually talking about adaptation. We're talking about the need to protect health from the full range of rising climate risks. And I'll talk a little bit more about that in a moment. And of course, that is crucial, but it's not the only task for health and for the health sector, for the health system, for people working in health. Because also important is climate change mitigation. The health sector also has its own responsibility to help reduce its own carbon emissions whilst also promoting health. And so in talking about climate change and health, we can't lose sight of the fact that we have to do our bit in reducing the contribution to climate change of our work in the health sector. So let's take a bit of a closer look briefly at adaptation, including health responses to climate change impacts and building resilience of health infrastructure and systems. Next slide, please. To facilitate the process of building climate resilience and reducing CO2 emissions, I'd like to highlight two additional specific WHO tools. And I apologise, it looks like I'm spending my time talking about WHO documents, but I guess they're both to illustrate the broader issues, but also to show you some of the resources that are out there that you might find useful. So first tool is WHO guidance on climate resilient and environmentally sustainable healthcare facilities. That's been developed and it focuses on suggested interventions to strengthen resilience and reduce environmental footprints of current healthcare facilities across 4 key areas of work, and that's WASH, energy, infrastructure, technologies and products, and the health workforce. And I'll say a little bit more about that in the next slide. Along with that, there are additional tools that have been developed to help establish baselines for resilience, including there's a checklist to assess vulnerability of healthcare facilities in the context of climate change, and there's a number of tools for healthcare facilities to assess their own carbon footprints that we're promoting, for instance, one from the Aga Khan Development Network and from Healthcare Without Harm. Next slide, please. So a little bit more on the guidance document mentioned just now. The objectives of this document, well, you can see the goal there, which is to increase resilience of healthcare facilities to protect and improve the health of their communities in an unstable and changing climate, while optimising the use of resources and minimising the release of waste by becoming environmentally sustainable. So the objectives of the document they're pretty straightforward, but quite important. They're to guide professionals working in healthcare settings to better understand and effectively prepare for the additional health risk posed by climate change, to monitor, anticipate, manage and adapt to health risk associated with climate change. Importantly, also to guide healthcare facility managers and staff to work with health determining sectors like water and sanitation, like energy, like transportation, food, urban planning, environment, and to provide tools to help healthcare facility managers assess their resilience to climate change threats and their own environmental sustainability. It also is to promote actions to ensure that healthcare facilities are constantly and increasingly strengthened and continue to be efficient and responsive to improve health and contribute to reducing inequalities and vulnerability within their local communities. Next slide, please. Things like strengthening WASH, strengthening basic water and sanitation, strengthening waste management, all of those different sort of things aren't just important for climate change, they're fundamental to quality of care and to safe care. How can we have safe and quality care being provided in our healthcare facilities unless we have good levels of water, sanitation, hygiene, waste management, and so forth? Next slide, please. Now, there's already been some good recent progress in this sort of space. Just a couple of examples I'll just mention very briefly. It may or may not be a coincidence that both of these relate to places I've been working. But anyway, so firstly, in Lao PDR, so WHO and a range of partners have been working to improve the WASH system resilience, particularly in the light of extreme weather events like floods, and also strengthening early warning capabilities for climate-sensitive diseases. In Fiji, the Ministry of Health and Medical Services here has really been very active in developing country-specific guidelines for climate resilience and environmentally sustainable healthcare facilities. So really, even with the challenges that every country's been facing with COVID, there's already been practical examples of countries moving forward on the sustainability agenda and on the climate change adaptation and mitigation agenda. Next slide, please. That, though, is not to say that everything is a rosy picture. So the next three slides are graphs you won't be able to see because they're quite small, but I'll describe them. These are graphs looking at the proportion of healthcare facilities in a number of countries in relation to three basic measures. So this first slide is the proportion of healthcare facilities that have basic water services. So this is the percentage in different countries. This graph happens to be Pacific Island countries. So, I mean, it's probably not so important that you try to read the which countries are which, although feel free to do so. But the main thing is there that only about, you would think that pretty much every healthcare facility should have basic water services. But actually, out of these countries, only half of the countries have got all their healthcare facilities have this. You know, a number of countries are in the 90%. But we've got countries down to 66% of their healthcare facilities have basic water services. You know, and basic water services are not fancy. They're basically, it just means that they've got improved water sources, like they've got sources like piped water or boreholes or tube wells or protected dug wells that they are able to access in their building or within the grounds of the hospital. So it's not a high bar. And so it is surprising that a number of countries, and the Pacific is not special in this. I'm showing slides for the Pacific. There are similar slides showing very variable performance in Asian countries as well. So next slide, please. So again, now this time it's healthcare facilities having improved sanitation facilities. So what that means is a healthcare facility that's got at least one toilet for staff, at least one sex-separated toilet that's got menstrual hygiene facilities, and at least one toilet that people with limited mobility can access. That's all it is. And you can see, actually, hardly any of the countries, 100% of their facilities have that. And there's at least one country there, 19% of their healthcare facilities have that. So a long way to go. Next slide, please. So this one is the proportion of healthcare facilities with basic hygiene facilities. Now, basic hygiene facilities means having the ability for staff to wash their hands with soap and water or alcohol-based hand rub that are available at points of care and within 5 meters of toilets. Again, it's a very low bar, and you can see there that only one country in that list has that in 100% of their healthcare facilities. And all those other countries are much lower than that, down to only a quarter of their healthcare facilities. So even on these basic measures, there is a long way to go. And you know, how can we be providing quality and safe care and care that's resilient in the face of climate shocks now into the future, unless these basic things are sorted out? And that's something that we working in the health sector need to take responsibility for. I think we cannot hope that somebody else will magically solve the problem. I think we all need to be solving that problem ourselves, facility by facility. Next slide, please. So just finally, so as I've mentioned briefly, COVID-19 has highlighted the very close relationship between health of people and health of the planet. Which, of course, many of us in public health have known about for a very long time. And it's further exacerbated the existing social injustices that we're seeing and vulnerabilities in our communities and in our health systems. But it's also provided a big opportunity for us to build a better future, a better, greener and more equitable future in our health systems. And really taking really fast and ambitious action to halt and reverse the climate crisis has got the potential to bring lots of benefits, not least for health. So next slide, please. And just to say thank you very much. That is the end of my talk. I hope I haven't gone over time. There's a couple of links there to the document that I was mentioning before. Thank you very much.
Yeah, I approve with the talk of Dr. Mark Jacobs. Dr. Jacobs, thank you very much for the talk that you gave us. I'd just like to acknowledge key points from your presentation. Number one is that a delay in acting will increase our vulnerability. And he said this in the earlier slides, wherein climate change really has increases the vulnerability of our health. Therefore, immediate action is needed, and a delay in acting will affect us, and the more so those who are vulnerable. Also, another point that I'd like to pick up was that the 10 healthy arguments, or the 10 health arguments, I should say, in the COP26 special report, which was just given, he highlighted two of them. And I'd also like to highlight that point. Number one is healthy recovery from COVID-19. And it's very important to look at public health as that which will increase the possibility of our healthy recovery, also the role of the health sector actually, and healthy facilities. So it's also very important that our facilities are not only resilient to climate change, but are also very good with assessing how they are. There was an assessment tool that he said what came out in order to assess our facility to look at its increasing resilience. He ended up with a conclusion saying that this pandemic has actually provided a better and equitable future for us as a chance to making resilience work in our communities and in our hospitals also. So there you have it, folks. Thank you very much. I would like to remind the participants to please write your questions in the room chat, all right? And we will get at them later after all of the participants have already spoken. So at this point, we invited 3 speakers from the health and community sector to share their experiences in fighting this pandemic and climate change, and what it means for them to have a healthy recovery. First to share is Dr. Ravi Singh. Dr. Ravi Singh, who is the founding president of Doctors for You. It is a leading medical humanitarian organization of India. He is the officer in charge of Homi Bhabha Cancer Hospital and Research Center. He is also the health sector lead of Sphere India Network and a member of the Asian Disaster Reduction and Response Network. Dr. Singh is the first and only Indian to receive South Asian Association for Regional Cooperation Award for outstanding work in the aftermath of disasters in 2010. Let's put our hands together and let's welcome Dr. Singh. Dr. Singh, you may now click go on stage.
Thank you, sir, for my introduction, and thank you for inviting me for this talk. So I was listening to the previous speaker, and it was a wonderful speech he has given. And so if you see in India, since last almost 2 years now, we are fighting this pandemic. My team is working across India in almost 23 states. We have established 40 COVID hospital, vaccinated more than 6.3 million individual with COVID vaccine, and we are still struggling to cope up with the COVID, and then lots of other issues which I will discuss. But I would like to highlight that I see as a doctor, health professional, this COVID pandemic very positively, because since last 12 years we were struggling to highlight all these things, that the climate crisis is basically health crisis. If we don't act, we are going to suffer, and it's our health. So what I think is the planet is not in danger. planet earlier 2 times. Also planet got totally destroyed, and then again it regenerated. But the danger is our life, our health, our future generation is in danger. So thankfully, this COVID pandemic has highlighted the importance of the health, and especially strengthening public health services, because across the globe, if you see at the peak of the first wave or second wave or the third wave, especially in the first wave, all the private hospital was totally closed down, and the load was very high on the public hospital. So there is no substitute for strengthening public health facilities globally. So the positive thing is, the first I see the health is at the center of political agenda. At least in India now we see like the people are talking about strengthening the health system, especially peripheral hospital, and the investment in strengthening peripheral health services has also increased. We now have almost at every block level and district level we have ICU facilities, ventilator and oxygen plant are being installed. So since last 1 year, we have seen massive increase in investment by the government, by the corporate and many other philanthropic organizations to strengthen the health system. The third important thing is disaster preparedness. Earlier, we used to struggle to explain the what is preparedness. People think when the disaster comes, then only we need disaster response. But the importance of risk mitigation and the disaster preparedness, now people have started understanding this. The one thing which we are facing currently is because of this climate change induced health crisis, the things are getting much more complicated. It's not that straightforward. Like, I'll give you one example, and I'm very sure every country is the health worker, doctor and nurses facing this problem is multiple crises at the same time. Like after the second wave of COVID in India, we massively started our vaccination drive. So all the nurses, health worker, they were deployed in COVID vaccination. And because of that, our routine vaccination immunization services goes down. So government asks, okay, along with this, you have to do routine vaccination also. And then this climate change induced monsoon, heavy rains, flooding happening all across India, especially in the state from where right now I'm working in, Bihar state. It is one of the poorest state of India, and the health worker is totally exhausted. They have to work on COVID vaccination, routine immunization, and simultaneously deployed on flood relief activities also. So the burden of this the climate change is actually coming to the health worker soldiers, and this is the high time that we should take it forward, and we should do the regular advocacy and sensitization of all the politicians, bureaucrats, policy maker, that this climate crisis is basically health crisis, and we have to work together to improve the situation. Other thing is, as COP26 highlighted, that there is no time left now. We have to start working, and we have to reduce the carbon footprint of health facilities. So the one challenge I see now, everybody is talking about this solarization, use of renewable energy. From health sector, I would especially like to highlight this the energy efficient medical equipment. So all the manufacturer in those who are manufacturing various equipment, they should also work hard on improving the energy efficiency. Like we have installed one CT scan at one of the rural hospital, and the electricity bill is so high, and because the patient load is less, so to make that CT scan sustainable, or manageable by the small hospital, we can't pay so much electricity bill. So what we need is equipment which utilize lesser energy and more energy efficient. So there are hardly any discussion on that side. So the biomedical engineers and all these manufacturing company, they should also consider that how we should make more energy saving equipment, cheaper equipment, so that we can take all these essential health diagnostic radiological services to the periphery hospital. The other thing is, but as previous speaker said, that the hot wave are going to be very, very common. So and especially in the tropical climate, our wards are very hot. So we need to find some solution for that. Also, maybe solar power air conditioning system for the wards and the ICU. In fact, in India, there is one city, Ahmedabad. There are many children died a few years back during the heat wave, because the ICU was on the top floor and it was so hot that the AC, everything got failed, and many children died. So with increasing heat wave, the burden is of this crisis is coming to health workers. So I think this Green Hospital initiative is a great initiative, and now we have to make it more visible, make it more local, and form advocacy group of doctor, nurses, policymaker, so that at district level, state level, we can do advocacy with our government and push them to make our facility more climate resilient and take urgent action to prevent this climate crisis. Thank you.
Thank you very much, Dr. Singh. That was quite succinct, and just to raise up, wow, that was a that was a powerful speech that you gave there, and you really were talking from experience. You can see, and we really appreciate that. Just a few pointers or that I picked up from his talk. This pandemic, he says, has really highlighted the importance of health, whereas before health was in the periphery. It is now in the middle of politics. In other words, now it is politically correct to think of health. And this, he said, was evidenced by increasing budgets for health and medical equipment. And it also raised up now, because of that, it also looked at now disaster preparedness and risk mitigation as very important in this response to the health crisis and its resilience. He says that there are now more complicated, right, health problems, because there are multiple crises that are happening. Like they have the monsoon and the flood, and they still have to treat people. The COVID vaccinations have taken away from the routine vaccinations, and we have to sensitize politicians. So you see, it has now become more complicated as a health problem, that we have to look at these things that are drawn together in order for us to become more resilient. And he was also saying, and it's a very important point this time, that this Green Hospital initiative is very important because it assesses and helps out in renewable energies and solarization, and looking at energy efficient medical equipment. When you are really at the challenge of electricity, especially in India. It's a tropical country. It's very hot. Among other countries like ours also here in the Philippines, heat is really a factor. And with the increasing climate change, extreme weather, it's really very hard to look at cooling systems. It's so expensive, and renewable energies really is a good solution to this. And thus, green hospitals, this initiative now is a good solution to round up and increase our resilience. It should really be a whole of government and whole of society approach. So, right, thank you very much, Dr. Singh. Again, if you have any questions, please write them out in the room chat. And at this point, we will now have our next speaker, who is Miss Libertad Dipon. She's joining us through a video recording. She is a local council member in a climate vulnerable village in the National Capital Region here in the Philippines. She is a women's rights and environmental protection advocate and a community leader who is serving the urban poor through the banner of Bangon Marikina, a community-led initiative aimed at providing support for families affected by flooding and other climate-induced disasters. Our stage manager will now play her video message. Let's take a listen to it.
Good day to each and every one of us here in our pre-conference of Green Hospital ASEAN, Path to Healthy Recovery. I am Ms. Libby Dipon, community worker of Bangon Marikina, Marikina, Philippines. Bangon Marikina is an organization composed of women, youth, and young adults from our community. First, I would like to give you a brief description of our community. Barangay Ipcc or Barangay Industrial Valley Complex has a population of 2,500 with about 4,494 households. Barangay Ipcc was located nearby Marikina River, and it is connecting other river of different cities going down to the shore of Manila Bay. It is also surrounded by 3 subdivisions where many politicians, military, prominent people, and alike. 70% of the population is under the lower income family. Most of them are helper, nanny, pedicab driver, tricycle driver, jeepney driver, and vendor of small market, or we call it talipapat. Their monthly income is not enough for their everyday living. In terms of services, our community has a barangay health center inside the community. Our barangay nurse, health worker, and doctor provide health services for pregnant women, children, and senior citizens. But most of the time, the doctor cannot give a full support and services for their patient. There are instances that he was at the vaccination site, but still, child vaccination and check-up for pregnant women are still taken care of. But there are also instances that they had to close the center or our barangay center for 14 days because some of the frontliners and volunteer workers get a symptom of COVID. Even the health workers, nurse, and other frontliners are not free from COVID. In November 12, 2020, Typhoon Ulysses caused the flooding of various parts of Metro Manila, especially in Marikina City. The damage during Typhoon Ondoy last October 2009 was almost the same in terms of water level of flood and aftermath. Thousands of things and properties was damaged. File of trust, household items was stacked up on the street and canals. No electricity and supplies of water was stopped. And because of the pandemic, some of the family member or individual where their houses has second floor and have a capacity to accommodate victim of flood or evacuees are hesitant to open their house because of the virus or COVID-19 virus. But Filipinos are known to be hospitable, charitable, helpful to each other. The virus was unnoticed by the people. Recovery period is faster than Ondoy. After 3 to 5 days of the flood, city government and other NGOs like Health Without Harm, Pag-asa Philippines, Salinlahi Children's of Concern, and many others help in cleaning the massive pile of trash, household items being swabbed in the muddy flood. Everyone tried to cope up easily, had their share by cleaning the surroundings as much as they could. Help comes from different people, institutions, organizations, providing clothes, food, water, and many others. Some are putting up kitchen mobile, kusinang bayan for feeding. After a month, we held a seminar workshop for women and youth regarding mental health, first aid, disaster preparedness, and creative art workshop for the youth with proper health protocols. Now it has been 1 year, and last November 20, we commemorate Typhoon Ulysses, participated by more than 200 women in Marikina, Philippines, in partnership of our local government unit. We believe that women and youth uniting as one will help lessen the effects of climate change. When, where, and how? If we could start organizing women and youth, because they have a vital role in the community. Start planting trees in all the denuded forest and even in our backyard. We suggest that every barangay may implement a project providing urban gardening to promote fresh vegetables and create a greener environment. Tree planting continue and also to prevent water pollution. Stop quarrying, logging, and large-scale mining. Inculcate in the mind of the children the responsibility of taking good care of our mother, nature, safeguarding their rights and promoting their welfare. Thank you so much.
There you have it. We had a community member talk about her experience in Marikina, which is part of a watershed area also, I believe. And it's also a city that's under threat because of the flooding. Marikina is a valley. That's why it is also very important that NGOs like Ms. Dipon is a part of Bangon Marikina, looks at community participation as that, which is very important, and specifically looking at how women and children can be organized to become part of this community effort towards increasing resilience and coming back with better health. She was also highlighting that quarrying and mining, which are still very much present, not only in Marikina, but in nearby cities of Bulacan, is also affecting the biodiversity and the change in the environment, and therefore they should also be stopped. And as with the other speaker, she was saying that, the action should be done now, right? So thank you, Ms. Dipon, for that very good talk that you gave us. We will now be asking all our plenary speakers. Thank you very much for everybody. Can I call them back again? Dr. Mark Jacobs and Dr. Singh to go on stage for the open forum, right? So if you can do that now, we would appreciate very much. Thank you. How do you envision, there was a question earlier, how do you envision a healthy recovery? What would be your criteria or indicators that you are looking for? I think you can both answer quickly maybe, so that we can have more questions that can ask. Do you have any indicators or criteria wherein you and how you can envision a healthy recovery? Dr. Jacobs?
Well, I mean, of course, we could speak for hours on healthy recovery, but from my perspective, I guess at a high level, it's about a recovery that leaves the health. Like if we're talking about like a healthy recovery in terms of the health sector and the health of people, then I think it's about the health system building back better, to use that jargon, so that it's stronger, more resilient, more sustainable, and the quality of the services that the health system provides are better than they were before COVID, and that it's better able to resist shocks, because future shocks, whether they are climate-related shocks or whether they are the next pandemic, are absolutely inevitable. And we and decision makers make choices about how big those shocks are going to be and how big the impacts are going to be. But I think it's with all of the focus on health, as Dr. Singh talked about, from policymakers, we do have a window of opportunity to really strengthen the investment into health systems, to make the health systems much stronger than they were before and much better able to meet the health needs of the people they serve, so that they're not driving inequality, whereas a lot of our health systems are inadvertently driving inequalities. So systems that better meet the needs of the most vulnerable, the hard to reach, in a way that can resist future shocks and future pressures. Thanks.
Thank you, Dr. Jacobs. Dr. Singh.
Yeah, so I would say for healthy recovery, I the most important thing is taking learning from the whole pandemic and taking, I would say, resolve or commitment to improve our disaster preparedness and working on basic like the workforce development, in investing more on public health and not to repeat the same mistake again and again, and for which we have paid very heavy price during the second wave across the globe. I think that would be that realization and commitment to change this status quo. That would be the healthiest recovery. Thank you.
Thank you. I'm just taking brief notes here, just to highlight again. Right, Dr. Jacobs was saying that it's very important that we invest in health systems, and I think Dr. Singh was looking at those examples, right, a while ago. More specifically, because being a practitioner on the ground, you were saying that a lot of learnings have come out of this pandemic, and losing a lot of health workforce also in the Philippines. It's not only in India that we've been losing them, both to COVID and also because they're just simply tired and fatigued with 2 years of handling COVID cases is no joke.
Yes, in fact, I would like to add one more thing here.
Yes,
that
please.
Philippines is known for providing good, high-skilled trained nurses globally. Similarly, in India, earlier we used to depend on South Indian state like Kerala, Tamil Nadu for nursing workforce. You will be surprised to know that in last 1.5 years, more than 600,000 nurses migrated out of India. So we are literally struggling to find the nurses, and during this second wave, we have to deploy dental doctors to do the nursing work because there are so much shortage. So the workforce development, especially the nursing and paramedical, is I think the topmost priority for the future preparedness.
You can see that this was also what Dr. Mark Jacobs was saying. It's really investment in health systems, right? This is looking at, looking at how the more vulnerable sectors should be funded. There really is going to be a lot of inequalities, especially with COVID-19 and the other pandemics. And Dr. Mark Jacobs was right in saying that, we will have shocks. Inevitably, the next ones are coming, and we should really be prepared for it. Yes, thank you. Thank you very much. Do you have any key points to boost the morale of our exhausted frontliners? What are some lessons that these 2 years have imparted so far on building up morale?
This is actually last week only we were also discussing the same thing, that in last two waves, massive waves in India, our health workforce is totally exhausted. Even today, more than 2,500 nurses, doctors and paramedics are every day doing vaccination. So they are totally exhausted, and now with this Omicron new variant, we are actually little worried that how to motivate, and because we in worst case, as a disaster person, I always think about worst case scenario. So suppose if the situation even 50% like of the second wave, we will be in a very difficult position. So what we have decided, we have not yet decided how to, but maybe we don't know about the booster. So we are planning if there is if WHO said that yes, the booster should be given to the high risk health worker, then maybe we will prioritize giving booster to our health worker, those who are on job, maybe giving some extra incentive to work, and probably recruitment of new workforce. In last 6 months, we have tried to develop additional nursing assistant and other kind of short courses for the helping doctor in managing COVID patients. So maybe this new workforce adds some energy. So these are the things we have thought of, but it's still work in progress.
Dr. Jacobs, at the high level, as you were saying, health investments. In Fiji, what are they doing now? Or in Laos?
Well, I mean, I guess they are similar but slightly different situations. So in Laos, they were able to keep the virus out of the country for most of the last 2 years. Even though it's a landlocked country, although they describe it as land-linked rather than landlocked, it was a big challenge, but they were very successful at really stopping any community transmission until I think April of this year, despite being surrounded by countries with very high rates of spread. Now, of course, that itself wasn't without cost. There's always a price to be paid for those very tight controls. And unfortunately now in Laos, because of Delta being harder to stop than the previous strains, it came in, and now they're struggling with lots of cases. So they're struggling with the day-to-day battle against COVID. Fiji, being an island country, it was a bit easier to keep it out for quite a long time. And that did happen, although it very much relies on its tourist industry. So it was very disruptive economically and socially, because so many people in the community lost their sources of income. More recently, one of the big advantages that Fiji's had is they had, like many countries in the Western Pacific region, very generous donations of vaccine from many partners. And so they've actually been able to vaccinate virtually their whole population. It's over 90% of people over 15 are fully vaccinated now against COVID, and it's 95% single dose. And what that means is actually, as of today, they've opened their borders again to international tourists. And so although they were seeing a lot of cases a few months ago, they're not seeing very many cases now. And so they've been able to build up the capacity of their healthcare system, train their workforce, things like that, during all of the battle against COVID. Now, hopefully, that will produce some lasting benefit, because, of course, there's going to be COVID in the country again. But that's the challenge: is how do you build on all of the efforts and all of the support to strengthen healthcare capacity during a pandemic, so that the benefit lasts. And I think it's far from certain that it's going to, particularly where there's, a lot of the focus is on doing trainings. This is how you look after somebody safely with COVID. And then in a country that's not seeing much COVID, then people don't get to practice that, which means they forget it. They need to do the training again. So that's going to be a big challenge. Another big challenge, and it's touching on the human resources issue that you raised and Dr. Singh raised. I actually worry about what the health workforce is going to look like once COVID stops. I think there are a lot of health professionals at all levels of the health system that are running on adrenaline. And when COVID settles down, I wonder how many health workers are going to continue to feel able to keep on committing to working as a health professional. I actually think there's a risk that we're going to be losing a lot of our workforce, whether that's in primary care or tertiary hospitals or public health, policy people. And we're already seeing people just saying they can't do it anymore. And that's going to be a very big challenge for all of us, is how we rebuild the workforce, how we support the workforce that we have now into the future, so that they can get the chance to rebuild their energy, if you like, recover from all of the effort they've been putting into COVID. But how do we actually grow the health workforce? Because if our health systems run with no spare capacity, then we shouldn't be surprised that they struggle when there's some major event that happens. So we need to try to come up with ways of building some extra capacity to our healthcare systems. And I don't know anybody's got the particular solutions to that yet, but yeah, I think that's going to be a big challenge for us.
It's really hard. It's long drawn, right? And nobody really has a solution right now, a quick solution. I think we just have to learn while we're going through it. All right. So there's a question here. How can we convince, CEOs or top people in hospitals to engage in a climate change mitigation program? Since it costs a lot of money to implement it, and it's really hard to convince these people. Maybe a quick answer from either of you. Dr. Mark?
Very simple, high-level answer from me. It's a mixture of top-down, bottom-up, and enlightened self-interest. So bottom-up is communities, workforce, people mobilising and shining more of a light on those issues, so that it becomes more and more uncomfortable for people not to take it seriously. Top down, there is a role for government regulation, so long as that regulation is enforced. And things like standards for healthcare facilities should include environmental standards for healthcare facilities. And there should be implications if the healthcare facilities don't meet those standards. But the other thing is the enlightened self-interest bit. It's about managers understanding why it's in their interest to take it seriously. And so, for instance, a big issue in Laos, and I suspect also in the Philippines, where I used to work before going to Laos, is a lot of the local healthcare facilities are built in places that are flood prone. And so, if the healthcare facility you're managing gets damaged every wet season, then surely it's in your interest to think seriously about whether you need to be doing something differently. I don't know, lobby for getting money to build the buildings back higher, or relocate to a higher location, all of those different sort of things. Or if the floods every year stop you having water supply for your healthcare facility, so you have to stop providing a lot of your services, well, surely it's in your interest as a manager to actually think about how, what you can do to try to make that a bit different next time, so you don't just keep repeating the same problem year on year.
Correct. I think now I'm seeing since last post-COVID, last 1.5 year, lots of discussion now. You see any newspaper, magazine, everywhere now. They are talking about net zero and renewable energy, climate crisis. So, and it is going on at very high level, and all the leaders at different leadership position, they are now realizing that time is up now, and we have to invest on all these things, and there is no alternative actually. So I'm very sure with the time, those who are not realizing, later on they will realize, but everybody has to follow the trike. So there is one saying that now you can't stop the idea whose time has arrived. So the time has arrived, so everybody has to change. There is no second option.
Okay, thank you very much for those answers. They're just saying here now, there's a question for green hospitals post-COVID, right? And we do hope that, I don't know if we can see a post-COVID scenario, if there are variants coming up every time. What could be 3 key learning points for green hospitals in a post-COVID scenario? Maybe a quick one. Any of you?
3 key, I'd say 1 or 2 key. The one is which we have learned that the waste we are generating through this the hospital, especially during, we have to manage it locally. So better to reuse the waste and handle locally, because the waste generated by this COVID and infection is highly infectious, and we literally face lots of challenges. So now the post-COVID, we have to find ways to manage the waste generated by hospital locally only. We can't depend on any other agency or any other state or the government or municipality. It's better if we focus. So that's the one. The second is, of course, is regarding energy. Again, there is one interesting example. We have converted lots of like a stadium into COVID hospital, marriage, wedding halls into COVID hospital in the first wave. But because these are like makeshift arrangement, so we have closed down all these makeshift arrangement after the first wave. We thought that we have won the war against COVID, and then this second wave strike. And during this second wave, the only facility which was already existing and we have upgraded that was the only facility which we were able to activate within 1 or 2 hours after this, when the second wave patient started arriving. So the learning is we have to make some, like, for the future preparedness, we have to make solid arrangement. We can't depend on this makeshift arrangement, especially the in this COVID, which comes in wave. How long you are going to make these makeshift? Indian Army had built many makeshift, and these are very costly, and they closed down all these makeshift hospital before the second wave, and because of that, in the second wave, we face lots of delay in restarting those facilities. So this is the second learning, that there is no substitute for strengthening the existing health facility, increasing their bed capacity for the future preparedness, and improving basically surge capacity of the hospital. So these are the two take I would say. Thank you.
Just a couple of comments from me, which are quite similar. I was going to say the importance of WASH. Dr. Singh's already mentioned waste, so I think that's very fundamental. Because as I said in my brief comments before, how can we be providing safe, quality care if we don't have appropriate WASH facilities in our healthcare facilities? The other thing, though, that relates to is not relying on special efforts when a disaster happens. The things that work well during an emergency are the things that are already working well and in place during peacetime, and people are using them during peacetime. And that doesn't mean that it only applies to rich countries. So I mean, it's not a. I'll give an example, but it's not a climate related example exactly. But in Laos, there was some investment in building a very practical common health information system for all of the healthcare facilities in the country, using open source software, easy to use, just use it on tablets, available at the wards through to the Ministry of Health. And they'd been working on that for a few years. COVID comes. There was no issue in Laos, which is quite a resource limited country, no issue in getting reporting all the time from every healthcare facility on the case numbers and how many people were coming in for all the different sort of conditions. And it was informing decisions at provincial level and national government level every day. Now, if we tried to build that with the country during COVID, we'd have no chance of having a system in place now. It worked under stress because it was already working before. And so strengthening basic capacity in health systems, and it doesn't have to be labelled emergency preparedness. It's health system strengthening. And so the health system strengthening that we do and do well during peacetime is the stuff that's going to benefit us most during disasters and shocks that the health facility will face later on.
Thank you very much to both of you. Well said. There are a lot of things that have to be done, and I'm so encouraged that we have a lot of ideas from our speakers right now. That may be the last question, guys, and it looks like we don't have enough time, and we would like to thank everybody who have contributed to all of this, both questions and answers, right? Just to pick up those three important lessons, actually. Waste generation management, right? From Dr. Singh, that's very important. Looking at future proofing, making our health facilities resilient. And part of that is looking at safe and quality care, as Dr. Mark was saying, having the basic WASH facilities in place and initiatives in place. And last but not the least, looking at preparedness. Whatever is working already is what you use. Don't invent something that's happening in a pandemic, because everybody is in a panic and it's not going to happen. So again, preparedness is very important in a disaster, in a pandemic, and in a health system. Well, there are a lot of other questions that are coming in, but we don't have the time anymore. Just to maybe close this session, this portion of the first day, COP26, its results, as it was said by Dr. Cabral a while ago, it should not disappoint us. Well, it really is disappointing because they did not really come up to a lot of decisions. But health and resilience for health are a long-haul initiative. It doesn't happen overnight, right? And our carbon footprint is insidious, and it knows, as our speakers were talking, it doesn't know any boundaries. And because it doesn't know any boundaries, our act should be together. We cannot act individually and separate of each other. So in order for us to become resilient, to build healthy, better, building back, as Dr. Mark was saying, better resilient communities, we should all be acting together. It makes for a better initiative and carbon footprint lessening if we do act together. And only if we act now, it's not tomorrow, we can then lay the foundation for the resilience that we're talking about. Yeah, so on that note, I would like to turn over our discussions to Manjit and see how things go on. And again, thank you very much to all of our resource speakers.
Thank you.
It's a profitable afternoon. Thank you. Jit, back to you.
Thank you, Doc Glenn. Thank you so much for the wonderful modulation of this opening plenary. To Dr. Cabral, to Dr. Jacobs, Dr. Singh, and to Ms. Tipon, it's very very powerful and inspiring messages and presentations. Thank you so much, and happy birthday again, Dr. Cabral. So before we move on to our networking session, I just like to remind everyone who haven't done so to please sign in, fill in your attendance sheet with your details. Our facilitator Paeng, our chat facilitator Paeng, has pasted the link in the chat room box. We will now move to our networking session so that participants can have the chance to make new friends and discover opportunities for collaboration. There are going to be 2 networking rooms opening up in a bit, and you should see that on the left part of your screen. And after these instructions that we will give you, feel free to enter the room you prefer, you've chosen. There are going to be 2 rooms, again, climate justice and plant-based. Those are the names of the 2 rooms. No need to overthink which room to choose, just go along with your first choice. But please take note, however, that the first room to reach 25 participants will automatically lock. So if this happens, please feel free to join the other room. The instructions for the room will be done via broadcast messages by PATS, but a networking facilitator, Paeng and I, will be there to guide you. So thank you everyone again for joining us in this plenary session, and to our speakers and moderator. See you all in the networking rooms.
Yang galing sa kalikasan. Okay. Um, my name is Ricky. I'm currently studying in the USA. I'm a health educator. I joined in this conference because I need to get or I need to update information about environmental issues because we know we face in pandemic and we don't know when this issue will be and in the future. I need to get information. I need to educate people around me and my community how to modifying our environment to increase healthy life and absolutely for increasing our quality of life as well by modifying healthy environment. Thank you.
I'm here because we have this program in our office, the Green and Safe Health Facilities. And Engineer June Philip will elaborate more.
Hello, sir. Yes, sir. Actually, we have been invited by the Healthcare Without Harm, and we always support the initiatives coming from the Healthcare Without Harm, especially with Mom, with Sir Paeng, with Sermon, and actually, this as mentioned by Architect Jean Pauli Policarpio, that we have the Green and Safe Healthcare Facilities program. So this at the moment from our side po from the Department of Health, from the Philippines Department of Health, is to have or to seek the essence of the universal healthcare in a more responsive health system, coupled with more equitable healthcare financing mechanism to provide Filipinos with high quality, affordable, and health products, devices, and facilities and services. So in this, we are also hoping to get or to check on what the Southeast Asian countries are doing for the green hospitals. We are also hoping that we can also contribute with other uh, with other participants as well to share with our initiatives and our current implementation of our program. Since we are from the health sector and from the and we also share this activity to the Department of Health hospitals, so they could also join for this activity. Thank you, sir.
Grupo kasi namin, isang nursing student, isang architect, at saka isang engineer. Ako naman ay nurse by profession na nasa management ng isang hospital din. So we are happy. Hindi. Dalawa kaming from Mindanao, isang taga Quezon City at isang taga up north. Thank you for dropping by. We are already Thank you so much. Again, ano bang pangalan ng grupo natin? JRL. Thank you, guys.
So that's it for our networking session for today, for day 1. So again, thank you everyone for participating, and we hope you had fun and made new friends. All right.
Hi again, everyone. Our session for today is almost over. But before we conclude, we'd like to show you a TED Talk done by Shweta Narayan, the International Climate and Health Campaigner of Healthcare Without Harm. Shweta will also be a panel speaker for tomorrow's session, but we wanted to share this recently released video where she talked about the need to keep planetary health and human health at the heart of climate solutions. This talk was conducted in October before the start of COP26 and as part of the TEDx Countdown event. Countdown is a global initiative to champion and accelerate solutions to the climate crisis, turning ideas into action. We think this is the perfect video to show to encourage and excite you for a session tomorrow. So I will play the video and I hope you enjoy it.
I grew up in Bokaro Steel City in eastern India. an industrial township surrounded by power plants and steel smelters. One of my fondest memories as a child was to stare in the evenings at the beautiful orange skies and flaring chimneys of the steel plant. Little did I know at that time that these were all classic signs of severe air pollution. Cities like Bokaro were dubbed as the temples of modern India that propelled the country into the 21st century. I now work at the intersection of environment, health, and justice. I've been in this space for nearly 2 decades, and my experience tells that the negative impacts of industrialization have outweighed the good. I've also in my work come across several individuals and groups who, despite all odds, go beyond their call of duty to serve their communities. I find healthcare professionals working in polluted places as one such group who strive to do everything they can to protect their patients and communities from risk. For example, Meena, a health worker from Korba district in central India. Her job is to provide maternal care to pregnant women. However, Meena lives in a region that is surrounded by coal and power plants and is considered among the top 5 critically polluted places in India. So Meena also gives advice on how to protect the newborn children from the dangers of air pollution. Meena and thousands of other health workers in India and across the world apply a concept that has been with us since at least the 5th century BC, when Hippocrates, the Greek physician, also considered as the father of modern medicine, wrote about the role of physicians in his book Of the Epidemics. He said, and I quote, "The physician must be able to tell the antecedents, know the present, and foretell the future. Must mitigate these things with 2 special objects in view with regard to disease, namely, to do good or to do no harm." The doctrine of do no harm forms the basis of the Hippocratic Oath, one of the oldest and most widely known codes of ethics. Now, the recitation of the Hippocratic Oath may be symbolic today, but most health professionals adhere to it daily, as we have witnessed in the last 2 years of the COVID-19 crisis. I'm here to make a case for 2 things: placing health at the heart of climate solutions, and placing the philosophy of first do no harm at the heart of all decisions beyond health, including those taken by our CEOs and politicians. Now, let me be clear about one fact. The climate crisis is a health crisis. It threatens our air, water, food, shelter, security, all the basics on which the human life depends. Burning of fossil fuels for electricity, heat, or transport is a major driver for climate change and a main contributor to air pollution. Globally, air pollution causes 7 million premature deaths each year. That's 13 deaths every minute. Way more than the death toll of COVID by the end of summer of 2021. And the poor and the marginalized are more severely impacted. Now, extreme climate events not only threaten people's health, but healthcare's own infrastructure and capacity to respond. The deadly floods of 2018 in Kerala in India, the state that I live in, forced hospitals to evacuate patients, suspend surgeries and critical care. Others faced power outages. Many reported destruction of the entire stocks of vaccines and medical supplies. And similar experiences have been documented in other parts of the world. Now, there's also a paradox here, and with it, an opportunity arises. While the health sector plays a central role in responding to the climate crisis, the sector itself contributes to nearly 5% of the net global greenhouse gas emissions and growing. Healthcare professionals understand the seriousness of their own climate footprint. In the last couple of years, we have seen an enormous momentum within the sector in charting a course towards transformative healthcare that starts with climate solutions. This momentum is guided by a zero emissions, climate resilience, and health equity roadmap. For example, the state of Chhattisgarh in India has solarized over 900 community health centers and pledged to attain 100% solarization to provide energy access, thus anchoring the resilience of the community and protecting the most vulnerable. Last year, England's National Health Service began charting a course to zero emissions by 2045. This year, 40 institutions representing 3,000 hospitals in 18 countries followed suit and worked with Healthcare Without Harm to decarbonize healthcare, its buildings, its operations, and supply chains in a race to zero. Doctors for Clean Air and Climate Action is mobilizing thousands of doctors across India on the issue of air pollution and health to advocate for better policies. Time has come that we measure the advancement of our civilization through the metric of health rather than metric of wealth. But here also lies one of our biggest roadblocks. It is impossible to have healthy people on a sick planet. The blatant disregard for environment, which is entrenched in our current economic and social models, has pushed the natural world to its limits. Failure to ask basic questions like, who is this business decision going to harm? Or what is the impact of the current policy choice on the most marginalized or on the future generations, has brought us to this crisis. COVID-19 is a clear example of our broken relationship with the nature. It has also shown the deep interconnections between the health of the planet and human health. We need to urgently mend our relationship with the planet. And this is where the principle of first do no harm in decisions becomes critical. Now, let me clarify one point here because I do not want any ambiguity. When I say do no harm, I do not mean that we should not explore the bold and courageous solutions. We desperately need to be innovative in the face of crisis. But there is a lot of bad, wrongful, harmful, and unjust behavior that happens knowingly, and that needs to stop. The overarching theme of the Hippocratic Oath is the idea that the individual who's reciting the pledge is making a personal dedication to ethical and committed care and putting their patients first. In Korba, Meena embodies this philosophy. She is doing her bit in protecting her community. However, that is not enough. The scale of challenges that we face today demands that all of us, individually and collectively, independently of our position, power, agency, or resources, adopt a similar dedication and commitment. And as a first step, we must all include the principle of doing no harm in all decisions, big and small, for all present and future actions, and put the health of our planet and ours first. Thank you.
All right. I hope everyone was inspired by that video. Indeed, it's impossible to have healthy people on a sick planet. Therefore, we in the health sector, we need to take clear and decisive actions to decarbonize, bolster just and resilient health systems, and demonstrate leadership to do no harm. So before we let you go, we'd like to remind everyone that our second session will start at the same time tomorrow. On day 2, we will deep dive into how health was considered in the agreements and commitments made in COP26. In the same session, we will also tackle the challenges and barriers that prevent health systems from making stronger climate commitments, as well as the opportunities for the health sector to decarbonize. We will have 2 breakout rooms tomorrow to facilitate the discussion after the presentations. In this regard, we ask everyone to quickly register to these rooms by accomplishing the Google form that will now be pasted on the room chat by our chat facilitator, Paeng. There will also be a 30-minute side meeting of the RISE Southeast Asia Alliance for Health and Climate tomorrow, immediately after the session. So if you want to virtually meet your co-allies as well as get the chance to be part of the alliance, please join us tomorrow after the main session. So thank you again for joining us, and have a good day, have a good night. Bye.